We had received a lot of questions this time, and I already shared that with you. So Angie's here. Should we take Angie's question first?
Yeah, sure.
Angie, do you remember you had written a question?
Hey, hi. Sorry. I'm on my phone and I'm trying to clean the screen because I couldn't see anyone. I actually, I know I had typed a question. I don't remember it though. But I actually sustained a shoulder injury, and I just started PT, but I wanted to know if there's anything that I could do above what I'm doing there. They believe it's rotator cuff, and there's a nerve in my elbow that I don't know, nerving and pain and ache in my elbow itself. So.
What was the injury?
Well, I'm doing a push-up challenge right now, and
Okay.
I think I've overused. I did, I'm up to like 2,000 push-ups for this month so far. So I think I had some overuse, and I think I compromised my form in like this one set, where it's an extended amount. But I didn't get an MRI.
There's a network issue at your end.
Exercise it. They did KT on it, which is helping a little bit, but yeah, I just know that I've, seen your videos and your expertise. Oh, I'm sorry?
No, there was a glitch. We could not see your video.
Oh, okay.
Yeah. In regards to, as long as the PT is doing like a lot of hand, shoulder, and they're giving you workouts to do for home, I would just follow that. As long as they're giving you the correct stuff to work on. So, if it's KT tape, definitely helps. If it's like an inflammation, you want to keep icing it up, and really just avoid anything that is bothering you. So like if the shoulder hurts you with doing a push-up right now, I wouldn't try to push through it. I would let it rest until it's 100%, and then you can kind of back into doing all that stuff. Do like go from like full push, go to like wall push-ups, and go to kneeling push-ups, and then go to full out push-ups. But if it's usually like pain in the front, I mean, are they doing like a massage throughout that area to loosen it up?
Yeah, they I start with the stim, and then they had heat, but I can't tolerate heat, so then I'm actually using ice, which I respond better, and the heat, actually I heat up instantly, and then I start getting wonky with the MS. So I expressed to them that that's not a.
I would stick with the icing it.
Yeah, and then they do like a really good massage, and but like my chiropractor, she adjusted my elbow. She worked on a nerve that goes from like the top of my forearm. She worked on that. She adjusted my wrist, and then all of a sudden I got the sensation back in my hand, because I had 3 days of no sensation. She was the first person I saw, and then she said, well, why don't you get into PT? I didn't go to the regular doctor yet. And then there's a place up here, really close to me. And they, when they put pressure on it, when I'm doing certain doing these external kind of rotations, when he sticks his thumb in there, it quells the pain. And then when I pull my shoulder blades back, the pain subsides. So it sounds like it's all positive, that I didn't do permanent, didn't do like a tear. So I'm just being extra careful. I'm going to ice more.
Pretty bad, like inflammation, tendonitis. So just keep doing what you get better.
Awesome. Thank you.
Yep, you're welcome.
But 2,000 push-ups was like, wow, in my dreams.
I love doing them, and I've been raising a lot of money, but at the cost of what? So I thought I was prepared, but 200 on your toes is a lot to ask of your body every day. So
okay.
Not complaining.
So Isa is here with us. Isa had 2 more questions.
there she is.
Hi guys. I submitted a question that well, I'm not 100% guys. Unfortunately, this is still a big process for me. I was really hoping that I had turned the corner this past week on Monday because I had like 3.5 really positive days. So that is what it is, and I talked to my neurologist about all of that, and anyway, I don't really want to get into like the medical aspect of it. I'm more interested right now just specifically about my left hip. Obviously, you know, I do a lot of yoga, and as a result of this past crisis slash coronavirus or whatever it is, because I'm still like on the shelf, my left hip is in pretty bad shape, and I'll explain to you what's happening. I wake up with just some ache, and it's specifically right on the outside of the hip. When I get active and I have the energy to do my yoga, and I stretch and I roll significantly before I even start even like actual yoga stretching and then getting into my yoga practice. So my yoga sessions are much longer than a regular yogi, because I know I have to really get my body kind of ready. After I'm done, well, I'll backtrack. During the session, I'm ultra limited, and I don't know if it's due to external rotation or internal rotation. I've looked online and I've looked at the tests that you can do. I believe it may be my piriformis muscle, because it comes from my lower back. It kind of hooks all the way around towards the front. That's kind of when I roll it and I get kind of in that L shape and your butt's down here and you really roll it like that, and you get on the side where you can really, and sometimes I grab a tennis ball. When I hit that part in my glute really, really deep, holy crap, I see the stars. And also when I roll on the side and I roll out the T-band, not all the way down to the knee because, you know, that's dangerous, but I get pretty close, really deep in the T-band, because I know that'll tighten up the hip. So I know the anatomy, I know the process, I've been there before, but this is something very chronic. It is now limiting all my yoga. And now when I walk, I hear, it's the weirdest thing. I hear an internal click slash pop.
Yeah. Have you been to like a PT or chiro?
I'm going on Tuesday because it got to a place where like I can't anymore. Like I'm really,
yeah. Because I'm not gonna really be able to like, you know, give you exact details, but I mean, you're doing everything you need to do with the rolling it out. But unless someone's like there moving your leg and takes a look to see what's going on, it's hard to give specifics without actually evaluating you. So if you're seeing someone on Tuesday, I would just give them all the information. But you said using like a tennis ball, you're going to get more specific. So what I would try to do is before your yoga, try to do those, like see what's limited in which particular position. Like, is it putting the leg in one way versus another? And then you could try rolling it out and then give that individual on Tuesday the information, like when you rolled out, this is what you were able to do better, but you still have limitations in this. And then they can, you know, assess it from there.
Yeah, and that's my plan. I just was curious on when, like, for example, like right now I'm sitting like an Indian style, right? And just the hip, just like I could just show you, like
it could be
it's just
the
like right
itself,
right down, like right down there, and it's like a constant like throb slash ache. And then also something that's really, really painful, and I don't think it's my quad, but it's like, I guess you could tell me what part of the quad. It's the little muscle that kind of goes up in the front of the leg, and then it goes down the quad, like the little piece, the muscle that's down around the big two pieces of the quad that head down. Does that make sense? Like when I get in there, like right where you would hit like your groin, from my groin down slightly, you know what I'm saying? And then sometimes if I'll bring my knee forward, like hold my leg and extend the other leg, and I hold it, the groin area, there's a massive pinch deep inside. And that, so there's just a lot of components, but like I was just curious what you would if you were to guess, because if you were to guess, you know what I'm saying, where do you think, because I think I'm reading and looking, and I try not to do that because that's how people can get more injured, right? If you were to guess, would that be the psoas muscle or the piriformis, or would it be that little ligament that's kind of popping over?
So,
Is it a bursitis or?
so I think it's really like everything you're describing is probably the hip joint itself, and all the muscles around it are probably just tightening up. So, because it's like pain pretty much around the whole area, front and side, back. So it's probably just the whole hip joint. But like I said, when they see you in person on Tuesday, depending if you're seeing somebody probably, knows what they're doing, they'll be able to kind of evaluate that.
Yeah, because it's really limited. I was at a place before I got sick that was almost non-existent, because I think I was muscularly stronger, meaning this, even the little muscles around the hip, the knee, the quads, like I was always very good at like, working on strengthening all of that. Like Angie was saying, like all the little itty bitty muscles, like your rotator cuff muscles, the tres major, minor, all of those little guys are in play down here. So it's just, what could be the clicking, the popping? What could that be?
The cartilage around the hip, like the labrum. Like if you're flexing your leg and then you hear like a pop, that definitely could be either the cartilage around the hip, or that could be the tendon. So, which the tendon, it's not a big deal, because then you can just do some like hip flexor stretching, and then it should reduce it. If it's the cartilage, then you got to do like more, manual techniques to the actual hip joints, like a lot of stretching. So if someone can kind of just like pull your leg, then that would help reduce some of that tension. So like I said, let's save it for the gentleman or lady that's going to see you on Tuesday, and then we can, they say, I want to get on to the next question, because we have.
Okay.
Do you have any question to ask the doctor? Elizabeth.
Oh, no, I'm sorry. No, I'm just listening.
Well,
So, doctor, I have been getting questions from patients regarding progressive MS. I want to know if there are any kind of exercises for progressive MS specifically, and people are quite scared. When they have progressive MS, is there any kind of different kind of exercise which they can do, or is it the same?
yeah, so that's a good question, because one is we want to try to really work on what the deficits are at that current moment, but that's when you really want to try to do like more full body, because our goal is to keep everyone as active as possible and out of wheelchairs. So if someone has MS and it's progressing, we really want to look at everything. So pretty much been talking about the last, I guess, like 6 weeks. Diet is very important, because if the body's going to attack itself on inflammation, we want to reduce that inflammation. So we want to try to keep the body as clean as possible, so we don't get additional exacerbations and lesions in the brain and spinal cord. But then it's really just about finding like workout routine that's going to be beneficial for the individual. Let's say it's doing a lot of stuff aquatically, or doing yoga, or like if they're doing exercise, really just trying to do full body, not just working on, your back or your core, but you also want to work on your ankles, your hips. You want to work on your grip, because a lot of times you will lose a lot of strength in your hands. So really just trying to get into a specific routine, like, are you going to do full body, once every day, or are you going to do like one day work on your arms, one day work on your legs, but getting into a good exercise routine to keep the body strong for long, just in case they do get lesions. Keeping a nice clean diet, trying to really reduce stress, as stress will exacerbate the symptoms. So maybe trying things like acupuncture, or just and that's pretty much really, what you can do is try to stay positive, eat as possible, continue being as active. I know I think last week asked, because they were younger, and they said, should they stop exercising completely because they got the diagnosis? And we kind of said it's the opposite. Like, you want to stay as active as you can.
Right.
And some neurologists will, I've had patients where their neurologist told them they shouldn't do riding anymore because they have MS. And that was, like, you really want to try to do everything you can. and continue living life, because if you stop doing everything, then that's how you end up in a wheelchair and disabled, and we want to avoid that.
Absolutely. So we can say at least 50 minutes of exercises focusing on different parts of the body you can cater to every day.
Exactly.
Doctor, the next question is by Chris, and he has written that will walking or jogging help my legs and balance, or would reactance bands be better than that?
What was the last part? Well, what?
Reactance bands or jogging or walking, which is better for balance?
So, walking is good cardiovascular exercise, but to actually train the balance, I recommend a lot of times do sideways walking, so my hips, and try backwards walking. Again, if this is safe for the individual. So if someone can't do it, I wouldn't try to do it if they don't have anything to kind of stabilize. But backwards walking, sideways walking, and then walking tandem style toe, that's going to train the balance system. And then with the bands, resistance bands, that's going to build strength, which ultimately will build the balance.
Okay, so the balance will be more for the strength.
Walking straight up the balance too much. It's more like doing like back walking heel to toe, walking sideways, doing those things to work on balance.
Right. Doctor, I can see there's a question by Evie here. She has written that exercises for hips. This is what she requires. Evie, is there anything specific you're asking for when it comes to hips? But okay, we'll take the next question for now. Has written that is there a problem if I get a routine massage, for example, once in 2 weeks?
No problem at all. That should feel good.
Okay.
Yeah, I mean, as long as because the massage can help with circulation with blood flow, that would be beneficial. But if there's any areas of like limitations, because let's just say the hamstrings get very tight from a lot of sitting, or the hip flexors, I would really just have the massage therapist focus on some simple, some specific areas that need to be addressed. So if one leg is the weaker leg, and that's where all the numbness goes down the leg, like let's say someone has shooting pain down their left leg or right leg, and it's in the front of the quad, those muscles are going to tighten up and turn, spastic or have a lot of muscle tone. So just information to the massage therapist where you're getting like the specific symptoms, so he or she can work on those areas.
Right, Resty. Your question.
Dr. Zolo, I'm sorry. That's the part you just described, the front of the quad. That area for me is where there's a lot of pain in that area. So can you describe that one more time again, what you just said?
Yeah, so massage therapist, or like when you see your individual on Tuesday, just have them really like allow the person to know exactly where the main points of dysfunction or trouble is, so they can really focus on those areas. But a lot of the times, if it's in the quad, doing something simple like just laying on your stomach and pulling that leg back with a towel, you'll feel a really nice stretch in the quad that'll go all the way up through the hip flexor. And also important to really just not try to do like a stretch for 10 seconds, but you really want to hold it for about 30 seconds minimum. But if the muscles get very, very tight, it's better to hold it for like a minute and a half, because you want to actually allow them to relax. What was that? You want to allow them to relax, so to get a nice stretch.
Okay, Evie has requested for exercises for hips. She said for strengthening of hips is something she requires.
Like what are strengthening exercises?
Yes, for hips specifically.
Yeah, so we showed a while ago. In one of the videos we did, pretty much bring your leg out to the side to work on this muscle right here. This is the glute med. This is a very important one for balance, having a strong pelvis. So while you're doing one leg, your other leg is going to be standing to balance. We're going to work on the so bringing straight back. Flexor, just kind of marching. So these are simple ways, but then another one that you guys can try is just really going side to side, keeping your toes pointed forward. This is what we call a penguin walk. This is one of the best ones, if everyone can see this. So what you're doing is you're kind of standing on one leg, second, waddling to the other leg, and even without a resistance band, you'll feel a lot of tension in this. And then, you know, bridging is another one that we showed on one of the videos. That was a really good one because that's going to work on your hip extensors. If those exercises are really hard or fatiguing standing up, then you could do the same thing laying down. So laying on your side, lifting a leg up, laying on your back, doing a straight leg raise, and then laying on your stomach and doing a hip extension.
Sure. Thank you, doctor.
And then, yeah, I don't know if, you know, those videos maybe, for anyone that doesn't know, we started posting those videos and they're on your Instagram page and my Instagram page, the MS Mondays series. So I believe that we do one of the first or second week, we perform some hip exercises, so they can check back on there too for specifics.
Sure, sure. Dr. Isa is asking, which bands would you recommend? Any specific bands?
They make like CLX bands, which are really good. That regular TheraBands that are good. I know they sell a lot like on Amazon, that come in like a 5-pack, and those are good because they give you the resistance like extra light, very light, medium, hard, extra hard. So they give you about, I believe the pack comes in like 5 or 7, and those would be pretty good. But you can also buy, you know, just regular TheraBands.
Right.
I would check on Amazon because that's usually pretty inexpensive there, as opposed to, you know, like Walmart. It's, you know, in all those places, it's more expensive
I
usually.
actually found resistant bands at TJ Maxx. I have the thing here. I don't know. Have you seen it?
Bring it up a little high. Yeah, yep, that's perfect. Yep, those are good because it gives you the different resistance. So there's so many different ones. I mean, you just want to make sure it's not like too tight around the ankles.
Oh, okay. So I start first with the extra light, then I increase to extra heavy?
Yeah, I mean, as I would go like up the colors and see, you know, if you just got them, maybe start with level 1 for the first 2 weeks. We'll go to level 2 because some of the exercises are going to be easy with the, you know, with the harder bands, but some of them might be difficult. So you might have to like need to switch around the loops, depending on which exercise you're performing.
Oh, okay. All right. Thank you.
You're welcome.
Doctor, there's this lady from Iran. She has written that she can't speak in English, so she has sent me a question. Right now, she had a relapse lately, and she's on steroids. And she said that my legs are very dry, and I feel there's no blood flow.
Yeah, I mean, with the blood flow, we can start with just doing like seated ankle up and down ankle pumps. Trying to do them standing up as well as, you know, just trying to get moving as much as possible. We have the video posted, exercises post exacerbation of symptoms. So I would have her relay back and maybe send her that video. But if everything feels dry, there might just not be enough circulation. So I would definitely start with the ankles and try to move around as much as possible. Good.
Ritu, you're on mute.
Yep,
Ritu, you're on mute.
Oh, so I'm sorry. So, doctor, I was saying, I'm sorry for it, that after how many days should she start this exercise? Because right now she's on bed rest after the relapse. And so should I just ask her to do her ankles up and down for now, laying on the bed, probably maybe after 5-6 days, she should start the exercises?
The ones that we put the video on with the post-exacerbation, I would start those right away because if people are even laying in bed for 3 days, they say 3 days of pretty much inactivities when you start losing muscle strength. So we want to try to maintain as much of the muscle strength as possible, keep her legs moving, because if someone's on bed rest for, you know, 5 days, 6 days, the muscles are going to get very, very stiff. So we want to try to get everything moving as quickly as possible.
Okay, I'll message her. Thank you, doctor. And the question that we have here is, how do you keep working out when the entire one side is numb? So this lady has her right side numb, the leg and the hand.
Yeah, so numbness is very challenging, but we try to figure out where is the numbness coming from, because individuals without MS get a lot of numbness, and a lot of times that could be that the nerve in the spine is pinched and that shoots the pain down the leg. So we have to find the cause of the symptoms. Where is it numb? Like if you press on your hip or your hamstring and it shoots the pain down, we know that is where that's where we need to focus. Um, if it's in the arm, it could be a lot from postural, or it could be a lot from your upper trap. So I think I'm not sure if we posted, did we post the videos with the nerve exercises or not yet?
We did post, I think. Yes, we did.
Yeah, because there's a lot of things that you could do for, the numbness in the hand, if it's the first two fingers, if it's the last couple fingers, but I would always try to find out from the neurologist and ask the question, is the numbness coming from the neck? Like, ask the neurologist, do you think my numbness is from the MS, or do you think it could be orthopedic? Because truthfully, neurologists are not really looking at orthopedic conditions, sciatica and a herniated disc in the neck. They're just looking at a brain MRI and they're saying, well, you have MS, or you have numbness. But that's not always the case, because we have a lot of patients who have a numb foot and we work on their back and that numbness gets better. And when you reduce the tension on the nerve and the numbness is reduced, then the balance automatically becomes better, because it's easier to walk when you feel 2 feet as opposed to 1 foot.
Right. Okay, doctor. I have another question, doctor. I believe we have spoken about this last time. Still, I'll like to repeat it. The lady has written that memory issues is bothering me tremendously. Could I get advices about it? Can physiotherapy be of any kind of help with memory issues?
So that's one thing that physical therapy doesn't really do. That's more of like occupational therapy or even speech therapy. But if it's like a really, really big issue, they have something called cognitive therapists, where they'll kind of recite the memory. But what I recommend is, using like a planner, writing things down, using like a Google Calendar. That way you don't miss doctor appointments. There's also, there's certain apps we talked about, just working on doing puzzles. Like memory works like muscles. You can always exercise your memory to help it. But yeah, I would definitely, do like a examination with somebody who works on memory and see what kind of things they can give for home. But definitely try to utilize like a planner in the beginning stages. That way you just try to get, more organized and not miss anything. But I'm sure maybe some individuals here can talk about things that they might have worked on with their memory to help out.
Okay. Doctor, I think these were questions that I have received on the page read. Is there any other question that any of you would like to ask? Denise, Senator, anything?
No, I'm just listening today. Thanks, though.
All right. Okay. Then
I have one last question. I'm sorry. I do own a stim machine myself from back in the day when I played tennis. And I can't remember, because I was going to try to put it on my hip just very, very gently. You're supposed to heat that area up first and then the stim, or is it ice? Or how does that work again? How does the PTs do it again? I forgot.
Usually you could put the stim right on. What I wouldn't do is ice it first, actually, because you want to be able to feel the stim. And if you ice it, that can kind of numb the area, and you could actually burn yourself with the stim if you put it on too high. So for you, like if you're getting a lot of the clicking and stuff like that, and kind of pain that wraps around, I would probably put the stim on. Don't put it like right on the bone, put it on the muscle, and then you could wrap yourself with a heat pack. And then you can actually do some of those stretching, because your muscles would be relaxed and you could get a bigger benefit that way.
all right, doctor. Then we can catch up next week again. Denise, do you have a question?
Yes, I have a question. How often are you supposed to exercise with the resistant bands? How often would you recommend? Like for twice a week, or I don't know how often to do it?
Yeah, I would honestly do it as much as you can. So if you do it every day, that would be beneficial. I would just try to change it up so you're not doing the same exact exercises every day. But you can work like on your arms one day, you can work on your core day 2, you can work on your legs.
Oh, okay,
But
just take turns.
I always recommend, I mean, if you could try to do something for exercise every single day, that's what I would
Mhm.
try to do.
Oh, okay,
Because
all right.
the more exercise, the faster you'll kind of feel improvements and gain strength. And if you get like a lot of soreness and pain, that's normal, because in the beginning stages you might not be used to it. So you just want to make sure you're not like doing everything all at once, because then you could get a lot of soreness. Try to break it up piece by piece.
Oh, okay, all right, thank you.
You're welcome.
Okay, doctor, thank you so much for your time. So we can meet next week again with more questions.